Hi, I'm Dr. Raji Rajakumar, pediatrician from Hampton Roads Community Health Center. I would like to discuss with you all about childhood obesity today. Why is childhood obesity so important? We are seeing a lot of patients who are obese. If you pick like 3 kids, one of them will be overweight or obese. The rate of childhood obesity actually has tripled over the last 30 years. So it's an epidemic actually spreading. So that's why we need to discuss about childhood obesity today. So let's discuss about childhood obesity, the definition. So how we say who is obese and who is overweight and which child has normal weight. So when the kids come to our clinic, we check their height, weight, and then we calculate the BMI, which is a body mass index, and then we plot that in the growth chart. We have 2 separate growth charts for boys and girls, and we plot the BMI, which is a body mass index, in the growth chart. And if the BMI is from 5 percentile to less than 85th percentile, that means the child has a normal weight. And if the percentile is above 85th percentile and less than 95th percentile, that means the child is overweight. That means you have to be more cautious because child can be obese soon. And if the percentile is above 85th percentile, if the child is above 95th percentile, that means the child is obese. That's the way we calculate obesity in the children. And then next we'll see who are at risk. So especially the girls, when we check, the girls, non-Hispanic black girls and also Mexican girls are at risk compared with non-Hispanic white girls. And the boys, basically Mexican white boys, are at more risk compared with non-Hispanic white boys. Now we discuss about the causes of childhood obesity. What causes obesity? Basically, the obesity caused by mainly a caloric imbalance. That means when we compare input and output, if you have more input and less output, that means you have extra calories stay in your body. So that stay actually change as a fat, and then that lead to childhood obesity. So when the kids are eating unhealthy food, excessive intake, and less physical activity, those kids are more tend to be obese. And other causes are like medication. Some medication can cause obesity, and also some hormones, some diseases like Cushing syndrome and hypothyroidism can also cause childhood obesity. And also another one is a genetic causes. Some genetic factors also can cause childhood obesity, especially if you have a family history, then the kids are also more prone to obese. Next, we discuss about complications of childhood obesity. I would like to discuss under 2 categories. One is physical, the other one is emotional. So physical, basically under physical complications, childhood obesity can affect every single organ in the body. So basically it can cause high blood pressure, diabetes, high cholesterol, asthma, breathing problems, sleep apneas, arthritis, joint problems, and eventually which will lead to adult obesity. And emotional, basically kids who are obese, they have low self-esteem because they don't like their body image, and also eventually they will be like depressed, and also they will have some learning problems. These are the complications of childhood obesity. And next we have to discuss about how we prevent this, because we have to catch them before they are obese or overweight. So how can we do that? If we start with a regular kid with normal weight, and if they're eating a little bit extra calories or unhealthy food and less active, then those kids are going to be mild obese. That'll be okay, they are a little bit obese, but if they continue to do the same, and then they're going to be moderate obese. That means they have extra calories, extra weight. Now they cannot go outside and play because the joint hurts, it's painful, and they have less exercise tolerance. And also they don't want to go outside because other kids make fun of them. So they're going to stay inside and watching TV, playing video games, and eat all the time, and also they are kind of depressed, that will lead to severe obesity. And so it's going to be a vicious cycle. Normal child and mild obesity, and they get into that cycle, then moderate, then severe obesity. They will end up with adulthood obesity also. So we have to intervene at one point. We have to catch them before they get into, your child get into obese. We can do that prevention actually under nutrition and physical activity and also lifestyle modification. So what can we do for nutrition? Nutrition basically starts from the beginning when the baby is born. Newborns, we have to do, most of the time we encourage breastfeeding. Breastfed babies are more tend to have normal weight. They are not going to be obese. So that's why we encourage breastfeeding. And after the first or second birthday, then after 2 years of age, we switch them to the 2% or 1% milk. And also 3 things we need to cut down after that. Fat, obviously, anything fried, more oil, French fry, fried chicken, we need to cut down fat. And the second thing we need to cut down is starch. Starch or carbs, that means white bread, white rice, white pasta. We need to cut down the amount, or we need to switch to brown bread, brown pasta, brown rice. And third thing we need to cut down is sugar. That means juice, any junk food, candies, cookies, all those sweets we need to cut down. I'm not saying avoid them, but cut down small amount. So those are 3 things need to be cut down. So what can they eat? They can eat more fruits and veggies. That's why we encourage 5 servings of fruits and veggies a day. So that's more helpful for them. And the second thing is physical activity. We need to encourage them to go outside, play outside, or do some kind of activity. Encourage them to do some sports. We need to cut down their screen time. That means watching TV, playing video games, something in the computer other than schoolwork. We need to cut down their screen time less than 2 hours a day. They cannot do more than that. And we try to encourage them, go outside and play, exercise 1 hour a day, at least 1 hour. So they can go outside, bike riding, jump rope, or just walk. We should encourage those activities. And the third thing is lifestyle modification. Lifestyle modification basically is come like a family. The kids cannot do by themselves. So it has to be like involves the whole family. So we can do that at home, try to make healthy food, cook healthy meals at home, get them participate in that, and also teach them how to count calories, and then limit the excess calories they eat. And also lifestyle modification, the whole family can go outside, go for a walk, and participate in some kind of physical activity. So make sure that prevention, the basics of prevention, I would like to emphasize we need to follow 5-2-1-0 rule. 5 means 5 servings of veggies or fruits a day, and 2 means 2 hours or less screen time a day, and 1 means 1 hour or more of exercise a day, and 0 means no sugar, no juice. So prevention of childhood obesity should be a team approach. We have to involve the family, school, and community. So how the family can help to prevent childhood obesity, like I discussed before, kids cannot do it by themselves. So the family should help them to make healthy meals at home, try to eat outside, fast food restaurants, and also make them go outside, play, or increase physical activity. And also parents should take them to their doctor's appointment, regular checkups, and also make sure they are not overweight or obese, and talk to their doctors about their weight and what can they do to prevent childhood obesity. And also they can go check the schools whether they are providing them healthy snacks at school. And next thing, school, how can they prevent childhood obesity? They can provide healthy food and healthy snacks at school, and control the vending machines at school, and also they can incorporate the curriculum that they can teach the kids about the childhood obesity and the calories. They can teach them how to count calories and about the healthy food and what food should be avoided. and how to maintain the healthy lifestyle. And also they can do more after school activities, involve more physical activities, sports. They can encourage the kids to participate more in sports, so that way the kids can be more active, which can prevent childhood obesity. And the community, how can they help to prevent childhood obesity? They can provide the kids the safe environment. The kids can go outside and play, safe playground, or they can make them to have some kind of physical activities outside school, especially a gym or some kind of recreation center, so the kids can go outside and increase their physical activity. So the prevention of childhood obesity, actually a team approach. It should involve family, school, and the community. State of Virginia have some programs which are really helpful to prevent childhood obesity. So now we discuss what's going to happen next. So we couldn't prevent childhood obesity and the kids are overweight or obese. What can we do next? Usually when they come, then we check their blood work to make sure they don't have diabetes, cholesterol, check their hormones, and check their liver enzymes, make sure they are healthy or they have any other medical problems. And then we refer them to weight management program. So they have to go to this program and they will meet the nutritionist there, and also they will meet some people, help them to do more exercise and physical activities. If these all things fail, and then the last resort will be medications and surgery, which is so painful. So we shouldn't encourage actually the kids to be obese and go to this medication and surgery. We should prevent before it happens. So I really want to re-emphasize that 5-2-1-0 rule, 5 servings of fruits or veggies a day, and 2 hours or less screen time a day, 1 hour of exercise every day, and please cut down sugar or the juices. So eat healthy and stay healthy. Thank you so much.